So, is it on? We all right? Huh? Okay. I'm going to use my outside voice. Shh, over there. I know you all pick it up because you have mics, right? This is okay? You positive? So I'm Rodney Ellis. Thank you all for coming. We're here in front of Bentob Hospital, and I'll just give you the lineup on speakers so they can come as they are up. Obviously, I'll speak first, then Director Robinson from the Health Department for the county, Dr. Porsa, who's the CEO of Harris Health, Dr. Berry, who's also with Harris Health or the Health Department. HCA. She's with HCA, so she will speak last. And I just want to thank you all for being here. We don't have a mic today, but I know you can pick it up. You can hear us. Today we stand in front of the Bentob Hospital, the last refuge for hundreds of gunshot survivors every year. For some, this is just one stop in a cycle of violence. Today, we're announcing an effort to stop that cycle in its tracks. I'm proud that Harris County Public Health is partnering with both Harris Health and HCA to implement a violence interruption program at the Bentob Hospital and HCA Houston Northwest. Partnerships like this between hospitals and the community are one tool that can be used to reduce gun violence in cities and counties across the country. These programs reduce the likelihood of retaliation after gun violence incidents by connecting victims at their bedside and linking them to services on the outside of the hospital. They save lives and taxpayer dollars. Bentob treated nearly 700 gunshot victims in 2021. Harris Health spent $45 million treating gunshot victims from June of 2021 to May of 2022. The hospital-based gun violence program, which is why we're here today, is already operating successfully within HCA Northwest Hospital. Since November, the program has served 39 patients and prevented at least 2 retaliations or re-injuries. Gun violence is an epidemic in America, not just here, but throughout America. 116 per day in America die from gun violence. Guns are the leading cause of death for children under 18 years of age. In Texas, the lack of policy solutions on the state level is necessitating an all-out offensive at the county and the city level. So we've rolled up our sleeves and gotten to work on creating innovative programs that get to the root cause of crime. This partnership with hospitals is just one of those tools in that toolbox. Since our community-based violence interruption programs began in Sunnyside, where I'm from, and Cypress Station last year, our outreach specialists stopped at least 12 shootings and likely prevented other cases. The groundbreaking work we're doing today is part of a larger vision that imagines what life ought to be like. Law enforcement agencies responding to violent crimes, not mental health emergencies. People having access to seamless wraparound support when they experience a crisis. All residents feeling safe in their neighborhoods. This isn't just a vision board, it's backed by our budget. We dedicated $1.4 billion on the county level to justice and public safety last year. The allocation is the largest in the history of Harris County. And we've allocated millions to address homelessness, poverty, hunger, mental health, and neighborhood blight. We're committed to using any effective tool to protecting Harris County residents from the epidemic of gun violence. So in short, here's how the program works. And the next speaker will make it even clearer, I'm sure. When someone has been shot or someone is a victim of a violent offense, usually their focus is on getting even instead of getting beyond it. And this program is a way to help people get over that violence, get beyond it, instead of retaliating and creating another victim of violence, regardless of how it was created. They work in tandem with law enforcement. They don't take on the role of law enforcement. They don't get into who did it, who shot who, why. Their focus is on giving people the wraparound services that they need so they can get beyond that violent act that they were a victim of. So with that, I'm going to bring up Director Barbie Robinson, and the other speakers will come up and say who they are. Thank you.
Good afternoon. I'm Barbie Robinson. I'm the Executive Director of Harris County Public Health. We are eager and excited to begin this partnership with Ben Taub Hospital to launch our second hospital-based violence interruption program. We all know that we need multiple tools to solve violence in our community, and I'm so grateful for the leadership and vision of Commissioner Ellis to bring public health approaches to addressing violence. We know that if we want to get to the root cause of violence, we need programs such as the Hospital Violence Interrupter Program to intervene and support individuals in getting their lives on a different path. And so we know that children under the age of 18, that the leading cause of death is gun violence in the United States as well as in Harris County. And in urban settings, it's estimated that victims of violence that are injured by violence are likely, 40% of them are likely to have repeat injuries if we do not intervene and establish resources and interventions to support their well-being. And so on November 1st, Commissioners Court approved the partnership between Harris County Public Health and HCA Northwest Hospital. And we're excited for the results that we've already seen in just a short period of time of disrupting and interrupting violence in our community. And on February 1st, the Commissioners Court approved the partnership between Harris County Public Health and Ben Taub Hospital to launch our second hospital-based violence interruption program. And how this program works is that we have individual case managers as well as credible messengers, and that's individuals with lived experience working with these individuals, meeting them where they are. So whether in the emergency room or at their bedside in the hospital, they begin to establish a rapport and a relationship and build trust with those individuals. These individuals are there not as part of solving the crime, but as part of solving and providing solutions for how individuals can get their lives on a different track and a different trajectory. And in order to effectively do that, we need to bring other resources, wraparound services, economic opportunity, workforce development, mental health and trauma services, housing support, food assistance, to help get these folks on the right trajectory. It is so important to disrupt repeat instances of violence, but also it's really important to change the life trajectory of the individuals that we're working with. And we are so excited, again, to see this program as part of the public safety ecosystem and advancing efforts to reduce violence in Harris County. Thank you.
I'm giving this is what you call filler. You ready? I know Telemundo is doing the pool. So we're here today to announce the Violence Interruption Program. And we have two great medical institutions that are participating. Today we're here in front of Ben Taub because this one is particularly important, because this is the place you want to go if you're in a traumatic situation. In fact, I always tell folks, anywhere I go in the country, the public hospital in any city or county in America is particularly good at dealing with trauma care, because it unfortunately is where most people go if they have a gunshot or some traumatic situation. We are fortunate to have Dr. Porsa, who's the CEO, who does a great job, and I'm just so proud that Ben Taub has signed on this program. So if I've done enough filler to help you at Telemundo, I'll bring up Dr. Porsa.
Thank you, Commissioner. Good afternoon, everyone. I'm Dr. Esmail Porsa, President and CEO of Harris Health System. Pleasure to be with you all today. And I'll be brief. Even before COVID-19 pandemic, and for decades, really, we have all witnessed a decline in our mental health services across our country. This included closing of many of our community-based clinics, our crisis intervention centers, and reduction in the number of psychiatric beds in our hospitals. and a significant reduction in funding for behavioral health services. The result has been a shift in where we deliver the bulk of behavioral health services. Unfortunately, moving them from our communities where it used to be delivered to our correctional health facilities. Currently, our correctional health facilities in Texas are the largest providers of behavioral health services in our state. The approach of our healthcare institutions to victims and also perpetrators of violence has always been the same almost everywhere. We address the physical needs of the violence victim and the perpetrators of the violence, and then return them back to the community where they came from, where usually the violent event occurred. Every act of violence was basically seen as a nail, and we became really good hammers, just repairing people and sending them back to where they came from and waiting for the next violent event. The hospital-linked violence interruption program attempts to break this cycle by addressing violence at its roots. Victims of violence are provided support that previously may not have been available to them by providing them individuals' level of care by a social worker, not only when they are in our care, in our health systems, but also when they return home to their communities. The goal is to heal, to comfort, to educate, and to empower the victims of violence while in our care, and more importantly, when they return home. It is this support and this continuity of care that distinguishes this approach from our routine care, what we have done in the past. Going one step further, this program also hopes to attempt to reach out to the perpetrators of violence so that we can also provide them with the support and education so that we can reduce the likelihood of repeat events and hopefully lower the incidence of folks being sent to our detention facilities rather than receiving the mental health and the social care that they need. I want to thank our Commissioner's Court, Commissioner Ellis specifically. I want to thank our public health, our county health department for this partnership, which I am sure is going to help us reduce this number of violence events in our county. Thank you.
Good afternoon. My name is Cherie Berry. I am a trauma surgeon. I'm also the trauma medical director at HCA Houston Northwest. I'm also the regional trauma medical director for HCA Gulf Coast. And I'm very excited to be here, and I'm excited for Ben Taub as they're able to start their program because I've seen the impact it's had at our facility since we've started our program back in November of 2022. Prior to COVID, we had noticed the increase in the prevalence of patients that were victims of violent trauma. And so we knew that there was something that we needed to do. Not only was there a steady increase in victims of violent trauma, but we were noticing an increase in recidivism. And so those are patients that were coming back up to 4 times because they were survivors of some violent trauma. And research tells us that once you're a victim of one form of violence, you're at an increased risk of being involved in another traumatic and violent event. And so programs like these, collaborations with community stakeholders like these are so vital to preventing repeat victims of trauma. We have already had success with our program in halting 2 retaliation efforts that could have been major violent traumatic events. We've enrolled over 50 patients in our program just since November. We're excited about the opportunity to continue to expand on this program, and we're excited to continue to partner with the county, and so thankful for the commissioner for making this available. Thank you.
So as we go to, I'm going to do Spanish now. You going to have me doing Spanish? Good luck. They had me take French. What were they thinking?
Wow, sí. Buenas tardes, mi nombre es Lupe Washington, soy la directora de la División de Interrupción de la Violencia con el Departamento de Salud del Condado de Harris. Estamos aquí para hablar sobre el programa de interrupción de la violencia en el hospital. Nuestros especialistas de enlace comunitario trabajan con sobrevivientes hospitalizados de la violencia inmediatamente después para brindar apoyo compasivo, intensivo y recursos. El programa es un nuevo programa piloto para pacientes que viven en 4 códigos postales. Vamos a trabajar con las víctimas de violencia armada, apuñalamientos y agresiones agravadas. El objetivo es ayudar con la recuperación y ayudar a los sobrevivientes a evitar futuros incidentes violentos y lesiones. Nuestros especialistas de enlace comunitario trabajan con pacientes en el Hospital Bentab, un centro de trauma de nivel 1 en este condado. Nuestro programa ya se lanzó en el Hospital HCA Noroeste el 1 de noviembre del año pasado. Desde el lanzamiento, este programa ya nos han referido a 39 pacientes. El programa aquí en Bentab se lanzará en cuanto ellos contraten a su trabajador social. Muchísimas gracias.
So as we go to questions, I want to stress that I appreciate the support of Judge Lena Hidalgo, Commissioner Garcia. In particular, we were, the 3 of us, pushing for this some time ago. Commissioner Briones has raised the issue of expanding it and some of the other data-driven approaches we've looked at, and I appreciate Commissioner Ramsey as well. But it is an effort that I think all of us want to work, whether someone voted for it or not. And with that, we'll go to any questions that anybody might have in the media. Good.
Yes, thank you. So we've seen success. Like I mentioned before, we've had 2 incidents that were halted that would have been retaliation events on a mass scale. We've enrolled over 50 patients into the program, and we've received great feedback, not just from the patients, but also from their families, because when you're a victim or survivor of violent trauma, it just doesn't impact you. It also impacts the family and the community, because it's more than just physical injury. There's a lot of mental components to this. There's impact on productivity, ability to keep a job, the children that are witnesses of this violence. And so by having programs like this, it really has a larger impact than just one person. And we've seen a lot of great feedback from our patients as well as their families.
Anybody want to add anything? In Spanish.
Si los resultados son de que queremos evitar a que hayan más víctimas. O sea, si trabajamos con las familias que, como mencionaron, ya hemos prevenido a 2 incidentes donde la familia pensó que sabían quién eran los que le dieron tiroteos a sus sobrinos, y con nuestros trabajadores que trabajan en la comunidad, ellos pudieron hablar con la familia para que no fueran a salir y ellos mismos hacer lo mismo y tener más víctimas. Entonces vamos a estar evaluando este programa, ya lo estamos evaluando, todos los datos. Cada vez que una persona, cuando nos llamen, cualquiera sean los recursos que necesiten, o sea, comida, o cómo ayudarles con su recuperación. Muchos de ellos ni siquiera tienen cómo ir a sus citas médicas, tal vez necesiten ayuda, consejería mental. Vamos a estar tratando de todos los números de todas las citas que tienen nuestros pacientes. Entonces, queremos reducir el número de incidentes violentos que tenemos en este condado.
Was it the same question?
That was a different.
Oh, well, don't keep it a secret. Tell us.
Yeah, he was just
For those of us deprived,
measuring.
tell us in English.
Yeah, measuring the impact. He was asking, how do we measure the impact? We're hoping, as was mentioned before, we're reducing the number of retaliations and the number of incidents that individuals are coming back into the hospital and being re-injured. I think Dr. Berry mentioned that many of these patients come back. 40% of them, if you're a victim of crime, you're going to come back 40-50% of the time within 5 years. And so we're hoping to reduce those numbers by helping these families, as was mentioned earlier, with wraparound services, whatever they may need. Many of our patients don't even have rides to get to their medical appointments. They may need mental health, counseling services. So we are hoping to kind of fill all of the gaps that our residents may need to help them in their long-term recovery.
I want to stress this as a data-driven approach, and we tried it long before we did. So we have the benefit, by being so late in the game to do this, of looking at how it worked in other places around the country. But look, it's a real simple proposition. Anger is a very human element. First time I heard about a violence interruption program, I was in the state senate, and I was thinking how I'd like to strangle somebody because they didn't vote for my bill. So it's a very human element if you've been shot, if you've been stabbed, if you've been beat, to want to get even. So the focus is to get beyond it. Let the legal system sort that out. So it's trying to get around a very human element, a human reaction, to retaliate if you have been injured. And that leads to more violence. Any other questions?
Could you repeat the question?
You know, it's easy for you guys to come out here and say that this is a great deal that's happening right now. A couple of months down the road, a couple of years down the road, forget. How do you keep the guy who got shot last year? How do you get them to keep it in the system?
Yeah, I think that is one of the hallmarks of our efforts. As Commissioner Ellis mentioned, we've learned, and our programs are based on the lessons learned and best practices in other jurisdictions. What's a hallmark of our system is we bring long-term sustainable interventions. It's not just disrupting that singular instance of violence or providing cognitive behavioral therapy to convince someone to not engage in retaliation. We bring economic assistance, workforce development, and so those are long-term, long-lasting impacts that changes someone's life trajectory, and that is what's valuable about this model, that it's not enough to just disrupt the singular instance of violence, but we have to bring all of those other resources to change someone's life trajectory, and that is what this model allows us to do.
You go ahead. Yeah, come
I was just going to say, so the other part of that is the way this program works is that the first encounter happens in the hospital. So these are hospital-linked violence intervention programs. And why that's important is you're getting the patient or the survivor of violence at a vulnerable time close to the event. And so they're more likely to accept whatever resources or whatever changes need to happen. However, that intervention just doesn't stay or stop in the hospital. The resources provided continue outside of the hospital, but it's important to get them near that traumatic event and then continue offering the resources as they go on. And then in terms of how we will determine whether or not it's effective, well, we know it's effective because there's been a national push, and all of your major trauma centers across the country and my colleagues are moving in this direction because there has been research shown that these type of programs are imperative to stop the violence, the cycle of violence, but also we'll be collecting data and we'll be able to show, you know, at least after a year's time, the impact that we have.
It's a very good question. How do you sustain it? You have to have the resources. This is just one tool in the toolbox. As I said earlier, the gun laws in Texas are more relaxed than they are in virtually anywhere in the country. Even if we can't solve that, what we can do is work on the things we can solve. We still invest in traditional law enforcement. 46% of the budget, general operating budget, goes into boots on the ground, so to speak. If you count the whole justice and safety package, it's 66%. something percent. I can't remember it off the top of my head. But we're using evidence-based methods. When somebody's angry, all you're thinking about is getting even. You get a credible messenger who knows that community. It won't be me. You know, it'll be someone that knows that community to get them to focus on whatever the resources are that are available. Big problem with the need for mental health resources. Not all of them. You know, one of the best ways to get somebody, one way to keep somebody from becoming violent is if they have training, if they have a job. I didn't say it's the only way. I'm not talking about cuddling anybody. Some people, I will admit, are just bad people. So we have the resources to work on that. But what we're doing is adding other tools to the toolbox, whether it's gun buyback, violence interruption, holistic response. We're putting everything we have at our disposal on the table. But obviously the resources and buy-in from the public are part of it. Any more questions? All right, you got enough. I'm gonna give you a keynote. It's hot out here. It's amazing how you all stop asking questions in the heat. Do all my press conferences outside in the heat.